Hey folks, it's Dr. Gerstmar from Aspire Natural Health, and in this quick video I want to talk to you about how to tell if the supplements you're taking or the diet that you're doing are really effective. Now, a lot of people come to us and they've tried different diets, different regimens. It's not uncommon to have people come to us with an extensive supplement list, 5, 10, 20 different things, and sometimes more than that either a practitioner recommended for them or they discovered while doing internet research looking for answers and they added it to their regimen. It's completely normal and understandable. However, the first thing that we do when we see someone who's already tried a lot of therapies and hasn't gotten the results they're looking for is to get a good idea of what's worked well for them and what hasn't. And for many people, they may be doing a therapy such as a low FODMAP diet or an elimination diet or taking one or a whole bunch of supplements and not really have an idea or a clear picture of whether it's doing anything for them or not. And that's a rough spot to be in. You're spending a lot of money, time, and energy making these changes, taking these things, and then to not know if it's actually helping you. And listen, there are people out there, and you may be one of them, that need to do really extensive protocols, very strict diets, taking a lot of supplements. Some people are really in that place. Thankfully, many people don't need these really expensive protocols, expensive and extensive protocols, or they need them, but only for a short time, like 3 to 6 months. Our goal is to use whatever therapies a person needs to get the best results as quickly as possible. And just to be clear, for many people with significant health issues, that time could range from 3 months all the way out to 24 months. So we don't want to keep taking or doing things without a clear understanding of what we're trying to do and whether it's working for us or not. In the case of someone who's confused and just not sure whether anything is working or not, here's one of the first things we recommend. All right, write this down. Stop. If you're really not sure if something is working for you, stop taking it and see what happens. For some people, within hours to days, they'll see a flare of symptoms. And while that's not a good thing, it does tell us that what you were doing was working, or at least some part of what you were doing was working and should be continued, all right? Those treatments are valuable. Other symptoms may creep on over a period of a few weeks, slowly getting worse, and that typically tells us the dysfunction isn't as severe as if you have a big flare, but that whatever you're doing was still having a positive effect for you. After 1 to 4 weeks, if you haven't seen any changes in what's going on for you, then it's very likely that what you're doing is no longer needed. It may have been helpful at some point, but not anymore, or it may never have been the right treatment for you. Great, at least we know. If you don't need to do or take something, it's better to know about it so you can stop doing it. Once in a while, we find that people actually do better having stopped what they were doing before. The therapy was actually pushing them too far into another dysfunction, and stopping it let the body get back to a better place. Again, better to know. Whatever you learn from this test helps us to better understand what's going on for you. So there you have it. If you're confused and you're just not sure if what you're doing or taking is working for you, the simple way to learn more is simply stop what you're doing. If you feel worse after stopping it, then part or all of what you were doing is helping. If you actually feel better after stopping it, then we know that what you were doing is the wrong therapy for you. And if you can't tell much difference after 1 to 4 weeks of being off of these treatments, then it's likely that they're not doing much for you right now. The supplement or diet pause is something we often find really helpful for the people we work with. Now, we know how hard it can be to find the right doctor and whether the integrative doctor you find is really the right choice for you, or are you just going to spend a bunch of money and end up not any better off than when you started. So we've put together a quick guide to finding the right integrative doctor for you. You'll have the questions you should be asking to make sure that whoever you work with is going to help you get the results that you want. All you need to do to get this quick guide is fill out the short form below, and we'll happily send it to you for free. So go ahead and click down below. At Aspire Natural Health, we are experts at treating digestive issues and autoimmune diseases. If that's you, we'd love to connect. We offer a no obligation, no pressure chat to see if we can help you and if we're the right fit to work together. If we are, we'll move forward. If we're not, we'll do our best to connect you with the person who can best help you. You have nothing to lose, so please call us now at 425-202-7849 or email us at info@aspirenaturalhealth.com. Until next time, folks, take care.